What would you do if you woke up and your child was an entirely different person, with extreme anxiety, tics, and personality changes? For 1 in 200 children, this phenomenon is a reality. It's known as PANDAS, and it's not nearly as cute as the adorable Asian bears of the same name. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. It occurs when streptococcal infections, otherwise known as strep throat, create an autoimmune response, resulting in inflammation in the child's brain. The child promptly exhibits life-changing symptoms, such as a severe obsessive-compulsive disorder, severe tics, anxiety, personality changes, decline in math and handwriting abilities, sensory sensitivities, restrictive eating, and more. PANDAS is mainly identifiable by a sudden, intense onset of anxiety and mood swings, along with obsessive-compulsive symptoms and tics, associated with a streptococcal A infection immediately prior to the onset of symptoms. If these neuropsychiatric symptoms occur without strep throat, that's when PANS comes into play. PANS, or Pediatric Acute Onset Neuropsychiatric Syndrome, is a newer diagnosis to encapsulate all of the infections as well as environmental factors that could produce the same symptoms as PANDAS. PANS does not replace the diagnosis of PANDAS, but PANDAS now falls under the umbrella diagnosis of PANS. PANDASnetwork.org has a great chart that explains the differences between PANS and PANDAS that I will now read to you. So PANS is defined by the following criteria: abrupt, dramatic onset of OCD or severely restricted food intake. Symptoms are not better explained by a known neurologic or medical disorder, and the addition of at least 2 of the accompanying symptoms: anxiety, emotional lability, and/or depression. Emotional lability is mood swings, irritability, aggression, and or severely oppositional behaviors, behavioral regression or developmental regression, deterioration in school performance, sensory or motor abnormalities, somatic signs including sleep disturbances or urinary frequency. The onset of PANS may start with infectious agents other than strep. It also includes onset from environmental triggers or immune dysfunction. Clinical diagnosis of PANDAS includes 5 criteria: presence of significant obsessions, compulsions, and/or tics, abrupt onset of symptoms or relapsing remitting course of symptom severity, pre-pubertal onset, association with streptococcal infection, association with other neuropsychiatric symptoms, many of the PANS accompanying symptoms. Some children's onset of PANS is completely debilitating and they become homebound. Others are fine at school but completely break down at home. In any case, the child who was once functioning normally has now regressed and is seriously ill. PANDAS symptoms may have flared in the previous months or years before acute onset, but often lessened over time. If severe symptoms persist over many months, the child could have permanent cognitive damage. Children with PANS and PANDAS may have dramatic improvement by just being treated with the right antibiotics. However, further interventions might be necessary. How to cure the entire syndrome is highly debated. However, doctors and parents alike report that long-term antibiotics, intravenous treatments, and plasmapheresis is helpful. There are also effective natural treatments for PANS and PANDAS that I will link to more information about in the description. Research is still going on around how to heal a child from PANS. However, to address the suffering of children now, doctors recommend the traditional treatment for obsessive-compulsive disorder, including exposure and response prevention therapy and possibly a very low dose of SSRI antidepressants. Exposure and response prevention teaches children how to deal with obsessive-compulsive symptoms in their daily life. This has been shown to help the entire family function more calmly during future exacerbations while they look for medical help. Antidepressants are not normally recommended for PANS children. However, very low doses may be helpful to children later on in the disease. Sadly, many doctors do not know what PANS and PANDAS is. Finding an appropriate doctor for a PANS child can be difficult and time-consuming. Imagine racing against the clock to find a doctor when your child is deteriorating. With more professional and local awareness, we can teach parents and doctors what to do should a child have these symptoms. Treatment works best for PANS when administered as soon as possible. Therefore, it is vital we get the word out. It is possible for a child to recover from PANS. However, every child is different and recovery will look different for every child. There are many factors that go into recovery from PANS. However, with the right medical and possibly cognitive treatment, the child can recover. I will end this video with a quote from the IOCDF's article on PANS. As noted previously, in the absence of research, we cannot recommend doing nothing for these children. Their suffering is intense, and the risk of long-term damage cannot be ignored. We do not know if some of these children will remit spontaneously later in adolescence. We do not know if some of them will grow into adults with the most treatment-resistant OCD due to permanent basal ganglia damage. While we research those questions, offering treatment options at the local level, especially in the first few months after onset, could be critical to the long-term success of these kids. Now that you know what PANDAS is, do our children a favor and share this knowledge. You could save a family from a lifetime of pain. As always, my sources will be in the description, and I encourage you guys to research more about PANDAS and PANDAS. It is a fascinating topic, and it's something that, as I said earlier, affects an estimated 1 in 200 children. That's a lot of children to be going through this, and their parents are a lot of times lost and they don't know where to go for help. So help us out. Share this knowledge. And maybe you'll get to someone who has PANDAS or thinks their child has PANDAS, and it'll bring them closer to getting the treatment that they need. Thank you guys for watching this video. I hope you learned something. Hope you enjoyed it. And I'll see you all later. Bye!